Good evening, everyone. Welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James, and I am the owner of Limbs and Things, mobile and telehealth physical therapy practice. I serve aging adults in DC, in Maryland, and in Virginia. And tonight we are talking to Miss Patty Carpenter. She is a nurse practitioner with Ennoble Care. And Ennoble Care is a primary care organization that works with us. I almost said physical therapy. I'm so used to saying that. But I wanted to invite you so much to welcome to Limbs and Things. We do pull ups every Saturday. We bring a company on that talks about something that aging adults need. And so tonight, there have been some patients who have gone through a little bit of change with their medical staff, whether the company has had some challenges due to COVID, or they've just decided I want to switch to another provider. And so Ennoble Care provides house calls to seniors within your home providing primary care. So welcome, Ms. Carpenter.
Thank you. Thank you for having me.
Sure. Thank you so much for joining us. So tell us a little bit about Ennoble Care.
Well, we're just like any primary care office. We have several providers, doctors, nurse practitioner, and PAs. The only difference is that you don't actually have to sign up to a clinic, an outpatient clinic, and wait and so forth. We just come to your home. So as long as you're considered homebound, you're qualified for this service. We take the same insurance as any providers, outpatient providers. So basically, it's just a way to reach out to a lot of homebound patients, or if some family members with issue going out, difficulty going out, we often reach out, and what we're able to do, besides diagnosis, seeing patient and physical assessment, we're able to do referrals for physical therapy and speech therapy, occupational therapy, and we're also able to get the labs, home visit phlebotomists in to draw labs so we can run some tests, and we also have the capability to order x-rays and ultrasounds and to your home. Um, so generally, it's like a doctor's office, but it's all happening at home, at the comfort of your home.
That's awesome. Okay, so if you're watching with us tonight and you have a question, please put it in the chat. If you're watching and you're live, please hashtag live. If you're catching this on the replay, you can hashtag replay as well. So we want to get clarification on what homebound means. Can you tell us? Miss Carpenter?
Oh, I'm sorry. So homebound basically just mean that if you have to be out of your house, a lot of times you need assistive device. So it could be a cane, it could be a walker, it could be a wheelchair. That you do have great difficulty going out. That you rely on transportation offer from other folks, and it doesn't mean that you have to be home all the time. And, you could go out for specialist appointments, or you could go out for hair appointments, Sunday church meetings, and so forth. You don't have to be bedbound to be considered homebound. So generally, folks that do have a lot of difficulty getting into their primary care doctor's office are all considered homebound.
Okay, thank you for clarifying that. Do you service? Where does Ennoble Care service patients?
Well, we're actually one branch of Noble Care in Maryland. In Maryland, we serve the Montgomery County, Prince George County. We do service Baltimore County. I think we're in the process of getting someone to work in the Baltimore City. I'm at Anne Arundel County, and I also do get down all the way south to Annapolis area. So that's where we are right now. But Noble Care has branches in New York, New Jersey, Georgia, and North Carolina.
Awesome. Okay. What do you think sets Ennoble Care apart from other companies?
Well, I think just that we have very experienced practitioners.
Uh-huh.
We do have a medical director who's pretty involved. I think what set us apart is that we encompass the community. So a lot of times we are familiar, for example, of their social issues. We are familiar with how to initiate help and care in the Department of Aging.
Hmm.
We are in contact with a lot of home visit providers, including PT and OT, even skilled nursing. I oftentimes in my job collaborate with hospice as well. I'm not part of hospice, but being an adult and geriatric specialty in my field, I unfortunately do encounter a lot of patients I have to referral for either like a supportive care or hospice care. I
Yeah.
think the major difference when it comes to primary care at home is I don't often feel like I have to rush through an assessment to really understand the setting in a kind of holistic way because we could see the family, the caregiver, we could see what's kind of going on at home. And oftentimes, I think we do end up spending a lot more time with each patient. I think we allowed maybe approximately 15 minutes to even an hour, depending on the case and what's going on that day.
That's awesome. Because a lot of times I encounter patients that say, well, yes, I had a nurse here and they were only here for 5 or 10 minutes. And that's kind of unheard of with Ennoble Care, right? So you take the time to really listen to the patient and find out the complete story because there's so much that you just don't get in a
Mm.
short amount of time that you get when you do spend a little more time with someone.
Right. In addition to that, I think one unique thing about us is that we do have evening after hours and weekend after hours, even holiday. So, as a lead tech nurse practitioner, I've kind of set up this on call system. So, you would be contacting our office that gets you to a on call center, but the person that they are tagged to respond is usually a nurse practitioner or even and a physician. So uh, that is usually what sets us apart is that we have outreach at any time of the day.
That's good. That's like urgent care all the time, right?
Sometimes I feel like, yeah, it feels a little bit like urgent care.
Yeah. Okay. Hi, Brandon. Hi, Melissa. Let's see. Melissa says a noble care is one of the best. I bet you would agree, wouldn't you?
Oh, oh, thank you, Melissa.
Brandon says, are you able to examine blood or get x-rays at the patient's home?
Absolutely.
Great. Okay. Is there anything that you think is important to share with someone who's receiving care at home that they probably don't know that they can receive that's different from being in the office?
Um, I think it's just besides easier access to any home health or home visit providers, I think in terms of getting the medical equipment, because all of our providers are very familiar with ordering like hospital bed, wheelchair
Mhm.
walkers, and so forth. Because that with our population, mostly there is an issue. That cause them to be homebound, and a lot of time it's mobility. I mean,
Yeah.
besides dementia patient where it's just really difficult to take them out to an environment that's too stimulating. So we do have a lot of understanding in terms of how to collaborate with the other home visit providers. So that would be able to get patient a lot more access, even if they're homebound.
Okay. If you're watching us, if you can hashtag live or hashtag replay, if this is something you're catching after we've aired live, please do that. We're glad to have you with us. If you are interested in contacting a Noble Care, the information is at the bottom of the screen. And then I wanted to find out from you if someone wants to have you as their provider, what's the process?
Well, it's very simple. They can just call the 240 number
Mhm.
and they can speak to our intake department and the staff would guide them. So, likely, what's going to happen is they're going to provide you with a consent form, consent to treat, and so forth. And they're going to also kind of make sure your insurance can cover the care. That way, you're not left with bills. And a lot of times, we're just asking for like medication list, a little bit of history about the person. If they have another provider that they're seeing, that they're transferring, I guess, or trying to find someone who's more able to reach them at home, they can always send the history, their records to us. We just kind of need the permission to do that. Or you can also try to contact us with the email, the EnnobleCare.com email at the bottom too. That way, you could just kind of get to us any time of the day. Because unfortunately, the 240 number, that's during office, hours, like between 9 to 4:30.
Right.
So if you can't catch us then, you can try to send us an email, and we'll respond in 24 hours to try to see if we could help you sign up. So if there's any problem, yeah, just email or call us. Either way is fine.
Okay. And how long from possibly submitting all of that information to being seen? Do you have a long time?
Well, it depends on how fast we get the response from the person or the family applying. So
Hmm.
oftentimes that is an obstacle. If, for example, they don't have internet access or fax machine, believe it or not, in Anne Arundel County, where I am right now, a lot of families don't have a, access to a lot of things. So, but often it's back and forth. I think the worst scenario is if you have to mail your information to us, the consent form and so forth, that may take about a week. But otherwise, if you can email us those information or fax it to us, that tend to expedite the intake process.
Got it. Okay. Let's see. Hello, Miss Cynthia. If you have a question and you're watching, please put it in the chat box or the comment box, and then we'll discuss it. What insurances do you take?
Well, that's a great intake team question. But I know all about 99% of my patients have Medicare or Medicaid.
Okay.
So as long as they're not signed up to a network where it's the network provider only, and that way we're not like out of network provider, then that's fine. So we really, that's a good intake question, and they can definitely check your insurance status with us when you provide that.
Okay. Great. Okay. So just to clarify, primary care is what? How would you describe it?
Primary care, I feel like we are the our job is to prevent people from going into the hospital.
Mhm.
And unfortunately, even up to this day, there are still a lot of folks who doesn't have primary care provider, and a lot of time there are symptoms, disease, illness that are missed. So unfortunately, when you don't have access to health care, there are a lot of the condition that could be treated earlier that could be delayed. So I think in terms of primary care, especially at the home care setting, I feel like our job is community health and personal wellness. Oftentimes, I feel like I'm a personal health coach in a
Yeah.
way.
Uh-huh.
I do also feel like in terms of the home health situation is oftentimes we can give providers like caregivers, families support because we're able to see the situation and make recommendation and allow them to have access to any community health or assistance. Actually, we do have one that is for mental health as well. We do collaborate with one company
Mhm.
called BHI. So I think overall, it's I feel like we're the goalies trying to catch any of the condition before they become serious and so
Yeah.
forth.
Mhm.
And we're also able to immediately know who to refer folks to if there are something that deserve a very close look in terms of their health condition.
I like that analogy. You're the goalie. Okay, here's another question. Is it possible to set up specific hours to have nurses come to your home? And also, if you don't have insurance, can a patient pay directly?
Yes. So what happened is our scheduling team will call you,
Hmm.
and they will give you like a date. So we try to cluster all patients in the same area so we can see them all on one day. But what they would do is call you in advance, usually about 4 days or 2 days in advance between those 2 days. And then they'll say, oh, Patty could be there at your house on Friday between 9 to 12. Are you going to be able to do that? If not, they can say, well, from 11 to 1. So we do have a about 3 hours time frame that we set with folks that we honor, depending on the circumstances. If there is an emergency, we definitely would call you and say, hey, we're going to be a little delayed. Our response time, if it's an urgent call, we usually try to see you within 2 days. With me, since the area that I cover isn't very far from each other, I try to get people in either the same day or the next day.
Good to know. The second part of that question is, if you don't have insurance, can you pay directly?
Yes.
Okay. Good to know. All right. If you are watching and you have a question, please put it in the comment section. One last question for you. What makes you stay with Ennoble? What makes it a great company to be a partner to?
I think it's the other providers. We have very good rapport with each other. I feel like although I'm by myself without an office, my
Mm-hmm.
office is the laptop, um, in my car. But I feel like whenever there is some issues or mystery diagnosis that I can't quite figure out, I can always text my colleague, and they're very quick to respond. So I feel like we have a very supportive little community together. Um, and I also like the fact that even though we left your home, but our service is still there available to you, and that's one part of Ennoble Care that's a bit unique. And I do also like the command center staff, which is our main admin staff. I've heard a lot of patients say, "Oh, well, they're very personable. They're very helpful. Um, they definitely respond at a very timely manner." And I know because they page me and they will follow up on, "Did you call that patient back?" So that's one part I really like is the connection.
That's good because that's so important. A lot of people just need the feedback, especially the communication aspect now, probably more than ever,
Yes.
just because we're so kind of out of touch with certain things. Is there anything that you think an aging adult should know, be if they do not have a primary care physician, to encourage them to have one?
I think it's important to know because I think aging adults they have Medicare, and this is something that they're really entitled to. They are limiting themselves to services and benefit that are entitled to them, especially an age bracket that really do deserve more attention. So I think that without primary care, they're losing an opportunity to make things better, to improve situation in terms of feeling of well-beings and so forth. I'm often told my older patients like, you're like a classic vehicle. You just need a lot of TLC, and you still are going to run just fine. So I think that's a very important part of primary care.
Absolutely. Well, it doesn't look like we have any other comments. I don't want to miss anybody. So if you're watching and you have a comment, you can put it there. I'll make sure we answer it. Thank you so much for joining us. I think it's important that we all have primary care physicians or nurse practitioners to help us with our care. And if you are without one, please seek one. Ennoble Care is in what areas again, Ms. Carpenter?
Well, that's definitely we're in Maryland, and in county we cover most counties in Maryland, and we do have branches in New York, New Jersey, North Carolina, Georgia.
Hmm. So if you're in any of those places, you want to go have a primary care physician come directly to you, then a Noble Care is the place to go. Uh,
Yes, and I also want to say, besides us, what you can do is you can always contact the Department of Aging in your county or health department. Oftentimes, they can give you a list of home visit providers as well. So there's definitely a lot of ways you can get a primary care provider in. Besides just us, so yeah, tap into that resources with Department of Aging or health department in your area. they are going to be able to offer you a lot of contact information and resources.
Well, I so appreciate your time and all of the information you've shared. Thank you so much for joining
Oh,
us.
you're so welcome. Thank you for having me. Take
Not a
care.
problem. Everyone, have a good evening.
Have a good evening.
Bye.
Bye.